Now, sure, it's all about looking your best, but feeling your best is really important. Dr. Tracy Davis from XL Dental is with us today, and we're going to talk a little bit about cosmetic dentistry. Now, I'm kind of right. The idea of looking your best is always great, but feeling it goes hand in glove, doesn't it?
Absolutely. You know, cosmetic dentistry is not just the aesthetics. It's about feeling good. It's about how yourself feels and the confidence that you extrude, the whole well-being part.
Well, when you think of cosmetic dentistry, I first think of cosmetic surgery, which, you think about the face. What is cosmetic dentistry?
Cosmetic dentistry can really be so many things, from whitening to straightening. You could do even some recontouring of the teeth that you have, or it could be adding some composite or bonding to the teeth. It could be veneers, or it could be a complete, total makeover as far as your teeth.
Oh, wow.
Yeah.
When I hear things like that, I'm just going with my own personal experience. When I started out going to a dentist versus now, a whole world has opened up.
Oh, it really has, and things are like changing so much as far as like the digital world. And when we sit down, we really kind of have to figure out what is beautiful for you, what that means for you. It's different for everyone, so it has to be personalized. And so then we can do like a digital mock-up. We could even show you what that looks like in your mouth before we started.
I think that's a great visual to kind of see what it's going to look like.
Yeah, it really is.
So what is the process then? Does somebody come in that wants cosmetic dentistry? Is it about straightening first and then, like you said, contouring, or is it veneers? Is it, there's so many things you could think of to have that perfect smile.
Truly, it's so individual because not everyone needs everything. And so we try to be as conservative, the least amount that's going to get you with what you want. The main thing is really figuring out, what do you want? Is there a smile that you admire? Or am I recreating the smile you used to have, say like senior picture time? Or am I just creating a dream smile that you've always wanted? Maybe you have a great smile. You just want a fantastic, outstanding one. It's so unique to everyone.
But it also seems like this is, people of course want a magic bullet. What you're talking about is a process though, is it not?
It is. Or it might be simple. It might be simple, it's just whitening. Maybe that's where they want to be. So.
Can I ask a personal question then for myself?
Yeah.
What if you think your smile is too gummy? Is there anything to do about gums? Because I feel like I love my teeth, but when I smile, I show too much gum. Is there anything, I'm just putting you on the spot here because you're here, and I want to know. What do you do about gums?
You know what, there's actually a couple of things that you can do. There are some like gum recontouring procedures that can be done so that you would show less gum. And there's also some Botox can play a factor.
I'm in. You said Botox, I'm in. I'll do it.
So if people have a gummy smile, it's really pretty easy. In fact, we have a medical doctor that's in our office that helps us to finish smiles. So sometimes it's the lips or the gum, lip flips. There are a lot of things that they do that help us to finish that smile.
That's all amazing to me. Now, of course, doing things like this, and even before that, there are products out there. There's always someone going, this is the next best thing. This is what you want. This does it 1,000 times better. Any recommendations as far as the way to take care of your teeth, to make sure that at least it's to the optimum of what you have?
Oh, we have a whole system on that. Where do we begin?
Let's start the simple way, toothbrush.
Toothbrush, I always recommend a soft toothbrush. I know when I walk down the aisles of the supermarket, there are so many toothbrushes to choose, and a lot of them are medium or hard. You really want to stick with a soft one. A lot of times we recommend an electric toothbrush like Oral-B or...
I have that one.
Yeah. Yes, that is a really good one. A lot of times it's the timer part of it, so it's using the 2 minutes.
So, Dr. Tracy, we have so much to cover. We're running out of time. Can you come back? Scan that QR code right there for that cosmetic dentistry, guys. Don't go anywhere. Join us over on Color 10 right now for Hour 3 on CBS right after this.